Africa Policy Day, where we talk policy on human rights. A very good morning and welcome to the 2022 edition of the Africa Drug Policy Day. My name is coincidentally Africa Malane, and it is my absolute pleasure and honor to be your host and MC for both this morning and the afternoon session. We live at a time when our communities are challenged and sometimes overwhelmed by issues pertaining to gender-based violence, to mental health issues, HIV, TB, drug use, substance abuse. Exceedingly, incredibly talented people are going to be helping us discuss this today. And we'll kick it off from there and ask, really, can we arrest our way out of the challenges that we are facing? These are important questions, Sean. I now hand over to you.
Yes, indeed, they're important questions. It's a knee-jerk reaction we have often to try and arrest our way out of problems. But in particular when it comes to drugs, which of course is my background, the drug policy and that kind of thing.
When the inspecting judge of prisons says that criminalization of drug use, production, distribution on its own, we're not condoning violence, we're not condoning criminal cartels, we are saying that criminalization of drug use, possession, distribution, and production causes criminal cartels, causes crime breakdowns, is a factor contributing to the massacres that we see on the Cape Flats, the degradation of policing and of the administration of justice.
It begs the question, have we not just perhaps taken a lot of the apartheid shortcuts in the law and applied them into the field of drug control?
An enormous tragedy of race, of class. I'm glad that you brought the racial issue to the fore. We are two white males facilitated by another male, by Africa. So I know the panel will take this up. We are still incarcerating people in our country. We have between 140 and 150,000 people in prison today. 1/3 plus of them remandees who haven't yet been found guilty of any crime. And they are almost entirely, not quite entirely, poor and black. We need to think, are we simply continuing the wrongs and the misdirected social policies of apartheid?
This cycle of being recruited into gangs in prisons and that, is this as bad as it's made out to be by some circles? I would presume, again, that you've had some experience in looking at these things.
Sean, I fear it is as bad. I think that the whole South African correctional system suffers from gang power. The war on drugs creates the power of for example, the Cape Flats gangs, because they want to control distribution, they want to control access, they want to control markets. And that leads to murders, it leads to turf wars, it leads to enormous violence, it leads to social disability. But it's a hard argument to make that we've got to rethink things and start again and start properly resourced, proper leadership, proper institutional mechanisms, proper capacitation of our country.
What I heard from that 50 minutes of conversation between Sean and Edwin is that we really need to start shifting the paradigm when it comes to addressing the issue of drug usage in this country and in the respective cities and communities we find ourselves in.
If you look at African policies, they are predominantly an approach that is rooted in the punitive criminal justice response. And this kind of response is expensive in terms of the human rights and public health resources that are being spent on police, judges, prosecutors, even the prisoners, like our guest of speakers rightly mentioned. Look at the amount of money that we spend in keeping a prisoner who is just caught for one roll of cannabis. In one breath, we are talking about human rights, and yet when it comes to the drug control mechanisms, we put aside human rights obligations by states and perpetuate harm on these people. And so, why is Africa still adamant in trying to address many of these challenges and moving away from criminalization? And let me conclude by saying that until we sit back and assess the situation and begin to take a paradigm shift towards more of people-centered or community-centered approach, we are likely not to actually achieve these policies or the Agenda 2030, as well as other targets that we have set for ourselves as a continent. In policy formulation, in laws formulation, this should not be left in the hands of the politicians. I think community must be part of this conversation and ensuring that they contribute to these policies that we have.
That one of the things that is not included in policy reform is particularly going into the communities and asking, because the very same drug user is my brother, right? And the very same drug user is a boy in my same community. And therefore, I think even the HIV response and the HIV communities, even the sex worker communities and the drug users communities do have the solution on how do we reform policies so that it impacts everybody. We see the global institutions themselves committing, to changing the laws. Even, with the political declaration, last year, it's a commitment made by governments that they will change their laws, and yet there isn't resources and capacity coming to the communities to say, you know the solutions, and therefore, how do we do it?
The same principles apply with all drugs. The only way that it wouldn't be unconstitutional to deny the person to use a particular drug in private would be if that drug is made more harmful through decriminalization. And there's no drug in the world that's made more harmful through decriminalization. We know that already.
In a moment, we'll bring you a recorded message from Marco Texera, who's with the UNODC. Marco, in his recorded piece, really focuses on how our response to this challenge has to be a whole community one.
Ladies and gentlemen, legislation alone will not be sufficient to address all forms of crime, and neither will governments alone will win this battle. We believe in a collective effort. A whole of society approach is needed to address the social root causes of injustice and that undermines justice, values, and society values, meaning governments engaging with multi-sectoral stakeholders, including civil society, communities, academia, media, private sector, NGOs, and other voluntary associations, families, and individuals, is essential for their active participation in adopting a sustainable way to prevent crime. I would like to reiterate UNODC's strategic vision for Africa and its commitment to work with all of you towards building peaceful and more just societies. And it is by supporting youth and communities and finding together innovative ways to prevent crime and violence, including gender-based violence.
So how do we make sure that people are protected, right? So I think it's looking at alternative measures, such as like the harm reduction. What result is it yielding? Rehabilitation programs, and also looking at in communities themselves. I really think that we underestimate sometimes how communities themselves are looking at alternative measures, right, to ensure that there's more prevention than actually treating the issue. So how do we look into that also, so that we just don't rely on the justice system, because we can see that that has really, really failed.
The focus this afternoon is on healthcare. How do we ensure that in trying to address some of the social ills that we are dealing with patients as our clients, if you wish, as opposed to prisoners, which sometimes pathologizing a challenge could lead to?
Pathologization, and particularly in the context of substance use, is thinking that people who are using substances are immediately sick and need some kind of treatment, whereas we know that many people use substances and can manage them. But often substance use can be linked with other issues like mental health conditions that may need to be diagnosed and then addressed. Well, I think advocacy like this discussion and these kinds of discussions is crucial to influence policymakers to ensure that services are funded and that they're accessible. So, for instance, harm reduction services, that the state should actually be providing clean needles and syringes and vials of sterile water. There should be easy access to opiate substitution treatment, and we need to provide integrated services. One of the very important secrets for success, or let's say elements that need to be addressed for success, is to establish a good, trusting relationship with the staff within that facility. And NGOs can help with sensitization workshops with the staff, with the healthcare staff, and also the security staff, frankly, in public health facilities.
So for me, a health system is not just about a primary healthcare system or a clinical care system. It's also about community systems. It's also about collaborative systems, and it's about coordination and partnerships.
First of all, I think we would recognize that the criminalization of drug use makes it really very difficult for people with substance use problems to even access services. And apart from the fact that for the greater majority, the services are not even available for them. The second thing that I want to speak about in terms of the problem before coming to how we may address some of these issues is that of stigma for people that use drugs. I think we talk about these all the times, but I think we should recognize that stigma is generally propelled by ignorance surrounding drug use disorders, because people see people with substance use disorders as criminals, but they have refused to recognize the fact that people may use substances for ritual purposes or for cultural or religious purposes, or people may just use it for fun, for leisure.
Hi, my name is Angela McBride. I'm the director of the South African Network of People Who Use Drugs. I would like to thank everyone for joining us today, and I hope that the sessions are fruitful and mind-opening and mind-blowing at the same time. Just to give a little bit of a statement on behalf of Sanput and our team, we just want to say people who use drugs are people first. We're humans. And as humans, so too do we have the same human rights as everyone else in South Africa. These basic human rights do include health, and health is not independent of drug policy reform. Not only are we pushing for decriminalization, but we're also highlighting the link between drug policy, health, and the importance of viewing people who use drugs as people first. Harm reduction and evidence-based interventions are needed to help improve the lives of people who use drugs. And by reforming and adjusting and standing up against the war on drugs, as well as current South African drug policies, only then would we be able to stand up and make a difference in our lives as people who use drugs, as well as in the country. Thank you.
Africa Policy Day in partnership with UNODC, Sanput, and TB HIV Care.